Kawasaki disease is a condition that is characterized by vasculitis of the coronary arteries. The coronary arteries are the arteries that supply blood and nutrients to your heart. They are vital to maintain a healthy heart muscle. This condition is also known as an acute system inflammatory condition. Because small and medium-sized blood vessels are inflamed, Kawasaki disease can lead to coronary aneurysms, myocardial infarctions, and death. Children ranging from 6 months to 5 years old have been noted to have this condition, as well as children outside of this range. Specifically, CD8 T lymphocytes are much more prevalent in the damaged arterial wall than the CD4 T lymphocytes. This causes myeloid dendritic cells to become activated. Colonization of the myeloid dendritic cells and the CD3 T lymphocytes also occurs. Research suggests that an immunoglobulin A plasma cell response occurs in the beginning stages of Kawasaki disease. This cellular response stimulates the immune system, specifically at a mucosal site. There's also a replacement of B lymphocytes with immunoglobulin A. A few people are at risk for Kawasaki disease. First, we have children that are under the age of 5, and then boys are also more at risk of developing Kawasaki disease than girls are. And then ethnicities such as Japanese, Korean, Asian, and Pacific Island are also prone to experiencing Kawasaki disease.
Kawasaki disease can cause some long-term complications. It can cause the echocardiography abnormalities in children, as well as cardiovascular issues years after the acute phase of this sickness, due to the inflammation and scarring of the heart and blood vessels. The scarring takes years, if not decades, to develop, and is frequently clinically silent, or it can go unnoticed, dangerously unnoticed. The scarring can cause the blood arteries in the heart to constrict, also known as coronary artery stenosis, resulting in decreased blood flow to the heart muscle. In other words, decreased blood flow, oxygen supply, nutrients, resulting in the death of that heart muscle. Aside from the coronary arteries, people with chronic or resolved aneurysms may experience heart difficulties as a late result of this acute heart muscle inflammation or myocarditis. Because of these potential complications, which can go unnoticed until it is too late, it is crucial, it is actually critical to have follow-up checkups so as to be proactive and potentially treat on time, so to catch these complications on time and then be treated.
Kawasaki disease has 3 phases: acute phase, subacute phase, and recovery phase. The acute phase includes an onset fever of 101 to 104 Fahrenheit, lasting 5 days to 2 weeks. Other signs and symptoms of the acute phase include irritability, red eyes without drainage, bright red chapped lips, strawberry tongue with white coating or red bumps on the posterior aspect, red oral mucous membranes with inflammation including the pharynx, swelling of hands and feet with red palms and soles, non-blistering rash, bilateral joint pain, enlarged lymph nodes, desquamation of perineum, hands and feet, which is peeling of the skin, and cervical lymphadenopathy. Cardiac manifestations of Kawasaki disease include myocarditis, decreased left ventricle function, pericardial effusion, and mitral regurgitations. The subacute phase of Kawasaki disease includes resolution of fever and subsiding of other manifestations. There's still irritability, peeling of skin around the nails and the palms and soles, and temporary arthritis. During the recovery phase, no manifestations are seen except altered lab findings. Resolution of the disease takes about 6 to 8 weeks from onset. The labs for Kawasaki disease include CBC, C-reactive protein, erythrocyte sedimentation rate, blood albumin, and elevated liver enzymes. The tests that are done for Kawasaki disease are a lumbar puncture to assess for meningitis and inflammation, a chest x-ray, and echocardiogram. To do a lumbar puncture, you will start with placing the patient in a side-lying position. This might require some help from an assistant. Identify the needle site. Palpate vertebral process, mark site with a pin, and then apply local anesthetic on area to give it time to give effect. Swab the insertion site with an antiseptic, have sterile equipment, don sterile gloves, insert needle at small increments at about 2 to 3 millimeters, and then remove the stylet from the needle. After this, you will collect about 1 to 2 milliliters of CSF into 4 collection tubes, and then you will run the test.
To prevent future healthcare problems, your child's healthcare provider will want you to begin treatment as soon as possible, preferably while your child still has a fever. The goals of the treatment are to lower the fever and prevent future heart complications. The treatment for Kawasaki disease can include gamma globulin and aspirin. Gamma globulin is an infusion of protein through your vein, which can lower the risk for coronary artery problems. This helps produce inflammation, thus prevents inflammation of your coronary artery. Giving aspirin to a child is contraindicated. However, that does not go for Kawasaki disease and rheumatoid arthritis. High doses of aspirin might actually help treat the inflammation. This can also decrease your pain, fever, and joint inflammation. Aspirin dose will likely be lowered once the fever has gone for about 48 to 72 hours. Once the fever has diminished, the child might be prescribed a low-dose aspirin daily for at least 6 weeks to prevent blood clotting. However, children who develop flu or chickenpox might be asked to stop taking aspirin due to development of Reyes syndrome. Reyes syndrome is a rare but life-threatening condition which can affect major organs of the body. The tests that we will do to diagnose Kawasaki and rule out these other diseases are, starting off with a blood test. We will get the basic complete blood count and white blood cell count. And if the white blood cell count is high, that can indicate infection, which is a good indicator of Kawasaki disease. We will then do an electrocardiogram. The doctor or nurse will put electrodes on your child's skin, which will measure the electrical impulses of the heart. This can point to major heart issues or issues with Kawasaki disease. The next thing that we will do is an echocardiogram. This is an ultrasound which shows how the heart is working, which can help identify problems with the coronary arteries.
Unlike other illnesses that cause fever and can be normally treated with ibuprofen or acetaminophen, this particular illness, Kawasaki disease, doesn't respond to those medications to reduce the fever. It only responds, the one that it does respond to is aspirin. Also necessary for a child that has suffered or is currently going through the acute phase of this disease is certain activities, exercises, diet, and nutrition. A key would be to provide care that is cluster the care so as to promote rest. We could also provide sponge baths for temperatures for the fever that is over 101 degrees. And a tepid sponge bath promotes heat loss through conduction and evaporation. It's to help relieve the fever. Another thing would be to provide adequate rest periods, which are critical as the child will get tired quicker, and we do not want to strain the heart. So we want to cluster the care and thus help rest the heart. And another thing we could do is use a cooling blanket for the acute phase or for the fever, in addition to the aspirin.
You might ask, how are we going to diagnose your child with Kawasaki disease, and how are we sure that your child has Kawasaki? Unfortunately, there is no specific test that healthcare professionals can do to diagnose Kawasaki disease. So diagnosing this requires ruling out other diseases that have similar manifestations as Kawasaki disease. Those diseases include scarlet fever, juvenile rheumatoid arthritis, Stevens-Jones syndrome, toxic shock syndrome, measles, and tick-borne diseases such as Rocky Mountain spotted fever. If your child experiences any sort of chest pain or breathing problems, notify the doctor immediately. This could be a sign of an aneurysm of the coronary artery.
So Kawasaki disease can put you at risk for complications later in life. First off, Kawasaki disease can lead to several heart conditions. Over time, it can cause the cardiac muscle specifically to become severely inflamed, and this condition is called myocarditis. Another name for the heart muscle that becomes inflamed is the myocardium. It can also cause the coronary arteries to become inflamed. This will affect the arterial wall by causing it to become weaker, and it may start to bulge. So the appearance and the size of the arterial wall will be different. The medical term for the change in the arterial wall is an aneurysm. This puts patients more at risk of developing blood clots if they have Kawasaki disease. Blood clots in turn can lead to internal bleeding and heart attacks. In some cases, the coronary arteries can be damaged so severely that death can occur.